Hi everyone, it's Chad again. Hopefully you were able to watch my interview video with Aaron uh, and kind of like hear my thoughts and um, experiences on like my trajectory from growing up in San Jose to going to UCI and then Cal State Fullerton for my master's and now being in San Francisco. This video is going to be me tackling on what public health means to me and how I look at it. First and foremost, public health is definitely my love and passion. I was very fortunate enough to go to a university during undergrad that offered it as a major. And I believe when I was at UCI back in 2010 when I started, it was one of the few UCs, and not the only one at the moment, offering a public health policy major. But what the field means to me, and I've always described public health as kind of like a giant umbrella. It's very interdisciplinary and borrows from a lot of different fields like sociology, psychology, the sciences, obviously, and incorporates theory and research, and it's really diverse, and I've always really appreciated that. So I always describe it as this overarching umbrella because even when you break down the word of public health, right, like public, including everyone and everything, and health. So that's been one draw for me. It's allowed me to kind of explore different areas like HIV prevention work, sexual violence prevention education. It's allowed me to work in the jail so I could kind of explore the criminal legal system. And currently I am working with LGBTQ youth, so giving back to my community in that way and really bringing my preventative public health lens. Let's see. Public health to me strives for a more equitable future. I know oftentimes when you're looking at different like career paths or like trying to define it, it can be very like abstract and rosy. I think public health is a way or is a future in which, you know, everyone has an equitable opportunity to good health and good life. And so many factors and issues are intersecting, and public health has definitely allowed me to explore and maybe investigate those questions that I have. I would say pursuing a master's of public health has been a really, really great experience because it's, if anything, it's given me a more critical lens and a lens in which I can, you know, not even when it applies to everything outside of the classroom as well, looking at a problem, what's the larger problems at hand, what are the factors are contributing to this outcome or this issue, and how can we kind of intervene on multiple levels to fix that problem. Everything from like a small little kind of task I have to do at home or a bigger issue at work. I would definitely say public health is less glamorous in the sense than the biomedical clinical field, just because you're working to prevent disease. So there's no like, just kind of like all those like TV shows on like hospitals and like and all that, the clinical side where it's like, oh my God, someone's having a heart attack, like let's save their life. I mean, yes, that's tertiary prevention, which is, you know, preventing something that's already happened, like, right? Like the heart attack is currently happening. How do you contain it? How do you contain all the factors that might affect that person? But public health is going all the way back, right? What was the person eating, right? Or why was their blood pressure so high? What are the factors of the environment that led them to do that? Their community, and taking it back further, maybe their community didn't have resources. Is that a result of policies that were passed so many decades ago? Why were they passed? Why isn't anything done about it? Does this reflect kind of like our national agenda as a larger thing? So you're allowed to kind of explore those different avenues. And that's something I really have enjoyed. Kind of like what I mentioned in the other video, feel free to reach out if you have any questions about pursuing an MPH. I know it can be very, very intimidating thinking about grad school, thinking about the whole process. There's also another series of videos that I have done. I'm sure it's being required in some capacity for you to watch on the different components of grad school and what to do. But with that said, hopefully this video was informative. And thank you, Aaron, for inviting me to do this. It's a really nice way to stay connected with AHA. Peace.